Now, on to health matters. Hypothermia is a serious health condition that can affect people of all ages, especially during cold weather. NBC's producer, Johnny Konja, sat down with Dr. Louise Kauzu, a general practitioner, to discuss what hypothermia is, who is most at risk, and how it can be prevented. Let's take a look.
We continue to bring you conversations that matter to, of course, all our viewers. And this morning we want to speak about hypothermia, which is, of course, a very serious, very serious medical condition. And we are going to speak about this with Dr. Louise Kauzu, who is a general practitioner here in the coastal town of Sokopun. Doctor, very good morning to you. Welcome.
Good morning, John. Thank you for having me here.
Absolute pleasure, Doctor. If you could explain to our viewers who are watching or listening this morning, how would you explain hypothermia?
Hypothermia is actually, like you said, it's a medical emergency. So this happens when your body core temperature drops to below 35 degrees Celsius. So what basically happens then, your brain, your heart, it starts to malfunction. Your muscles start to malfunction. And it goes into metabolic overdrive. So now you're producing heat faster than you're actually, and you're losing it, than you're actually maintaining the normal milieu of your body at that time. So that's basically what it is.
So if I'm a resident then in a cold coastal town, for instance, like where we are finding ourselves, what are some of the tips and practical steps to actually then take care of yourself to make sure that your body doesn't actually go below that temperature, which is of course 35 degrees, and how can I actually better take care of myself in a coastal town that's quite cold, such as Sokopun?
Oh, Sokop is a very moody place. We experience all 4 seasons in one day. But coming back to your question, keep warm, insulate, dress up properly. If you're going to swim, and we already have this Benguela current here, which brings an upwelling of nutrients, but it's actually quite cold water. If you start shivering, get out of the water, because shivering is a sign of hypothermia. Dress up, take warm sips of water or something sweet or soup or anything, just to keep that insulation and to keep your body temperature above its core, or at least to 37 degrees Celsius. Yeah. But most importantly, cover up. Wear your gloves, your beanie, if it's now in the cold season. But like during this time, we know that it's summer. It can be a little bit warm, but sometimes we tend to forget that the ocean is quite cold. So stay away from the ocean if you're not a great swimmer. Yeah.
No, totally. I'll take that. But let's talk about, we all know that we all have different bodies and they respond differently to different conditions. Who is most at risk, when it comes to hypothermia or developing hypothermia, and perhaps why?
Children, infants, the elderly, basically people with lesser insulation, and I mean lesser fat. Those are the people that are mostly at risk. People with heart conditions, because it can cause cardiac strain. People with chronic medical conditions, people with lung issues are mostly at risk. Yeah.
You gave us some signs, which of course shivering. Can you perhaps just give us some more to actually learn then how what these signs are if one is actually developing hypothermia, and what to look out for first of all, what to do immediately when you experience this?
So what happens in shivering? So you have these organs, your hypothalamus and your adrenal glands, if we go to physiology. So they signal, when your temperature drops, your hypothalamus, it signals your blood vessels to constrict, get away from your skin to try to, maintain the core body temperature. And then, but at the same time, it also signals your muscles to start shivering, which is like 5 times faster than it should, producing more heat, losing more heat, and then your body basically dysfunctions at that time. So that is what happens with the shivering. But what to look out for, signs for you to see, for instance, if you find someone outside the beach or lying on the beach, shivering, like we said, paleness, pale cold skin, the lips may be blue. One thing that we need to watch out for mostly is when the shivering stops. If the shivering stops, then we know, this is now dangerous, because now this person could be unconscious or going into a coma or just basically being cold shock. Yeah.
So that's actually then already a conversation that parents need to have, especially when it comes to their infants or younger children. What advice do you have for them, especially the parents and caregivers as well, when it comes to how they can better take care of their children to, of course, then lower the chances of them getting hypothermia?
Be vigilant. Always watch over your child, or like the caregivers. Look, remember what I mentioned earlier, the signs of hypothermia. Take the person out of the water, remove the wet clothes, keep them warm, basically. And for those that want to swim, wear wetsuits or swimsuits that are well insulated, but always just watch out for those signs, actually. Yeah.
What are doctors such as yourself, of course, trying to do to make sure that the communities and all other those that are, of course, interested in the medical practice actually are in the know of conditions such as hypothermia, and actually make sure that this is actually taken beyond what we just have as a community around us, but making sure that everybody knows about this?
Well, we have health. We do give health education, obviously, at the practices, in the general clinics as well. What the community can do, maybe put up signs by the beach at the posts, basically, and spread awareness of what you know and apply. Yeah.
Doctor, we of course are in the festive season. There's a lot of people coming to Swakopmund or rather all the other coastal towns where we can experience quite cold weathers as well. But what is your advice to them, and how they can take care of themselves, how they, not only when it comes to hypothermia, but just overall medically, as opposed to, or rather because of the causes of the weather, how can we better take care of ourselves during this festive season?
You see, Swakop is the coast is such a beautiful area. It's very important to obviously avoid these hypothermic conditions, stay insulated, but then also with alcoholism, come down with it a bit. And because when you drink a lot of alcohol, you're a bit impaired. You get what I'm trying to say. Some people, we've had some quite sad incidences last year where people would jump off of the jetty and go beyond. So it's just basically to take better care of yourself, stay in groups, make sure people know where you are all the time. That's what I can basically think of right now.
Your message to all our viewers for the festive season?
Enjoy the coast, enjoy responsibly, and have fun. Yeah, responsible fun. Yeah.
Thank you so much, Doctor, for speaking to us this morning. Hopefully we get to have another conversation about all other medical conditions. But thank you so much for your time and for your expert knowledge on this. Yeah.
All right. Thank you so much, John.
That was Dr. Kauzu, who is a general practitioner, speaking to us about hypothermia and also what are some of the signs that we can look out for, especially when you are in a coastal town that has probably colder conditions this morning. And we are still going to be bringing you conversations as the week goes ahead to, of course, bring you all up to speed with all the festive activities, the very, very important conversations that you need to have, what you need to know in terms of what to take, how to stay safe as well, and also how to enjoy your festive season better this holiday season. That's all.